Welcome back to another PCBH Snippet. Now this is a topic that we've talked a little bit about within stories of PCBH and also PCBH Corners. And that's the idea, how do you cultivate a sense of wellness and engagement with the work that you're doing? Without question, we are talking about very appropriately the amount of burnout and the amount of demand that is placed on healthcare workers. And that's very important because we need to really focus in on these contextual factors that are really eroding people's love for the work that they get to do. The one thing I wish we did more was talk a little bit about bringing intentionality to the moments throughout the day and more about what they reflect, the important work that we get to do. So for instance, this morning, I had to fill out a mid-year evaluation on one of our fellows. Now, I'll be the first to tell you, I'm not a big fan of paperwork, and I'm definitely not a big fan of filling out evaluations. They can be a little bit taxing at times and sometimes feel like busy work. What was interesting though is as I was filling out the evaluation, my mind became aware of what the evaluation was actually reflecting. The first thing that was reflecting is that I'm a supervisor. Now, I don't know how that has happened, and also that I'm a psychologist, I'm a doctor. And if you were talking to people from my hometown, I think a lot of them would be like, man, I don't know if Dave was going to be a psychologist when he was back in high school. So it's a cool moment of reflecting. It's like, wow, I'm a psychologist right now. The other thing it reflects is that we have a training program. We've had a training program for a number of years now. We've trained dozens of future psychologists to go and work in the primary care behavioral health model. It's pretty cool that that evaluation reflects that we have a training program. Lastly, it reflects that we have an incredible trainee that has done amazing work within the primary care behavioral health philosophy, has reached our community, has collaborated with our team members, has just done a phenomenal job. And while for sure, I probably wouldn't be the first one to volunteer to do evaluations, it was neat to see what the moment in that evaluation reflected. All these different things that show the work that we get to do so routinely, so regularly that we habituated to is really, really amazing and incredible. So it would be something that I would encourage you all maybe to do this week, is to find these moments that seem just normal, just seem like part of our routine, but actually are reflections. Me wearing scrubs right now, as I look at the camera, I see these scrubs on. That's pretty cool that I get to wear scrubs and to be part of a healthcare team. Taking a handoff and recognizing that the improbable moment that a PCP was able to talk to a patient about seeing a behavioral health and they said yes, and I get to meet with them for that moment. Completing notes and documentation, while not fun, but it's a way of us reflecting our values and working and collaborating with the PCP. And yes, even filling out an evaluation form. That might not be the most fun thing to do on a Monday morning, but it's something, even that behavior, even that moment, reflects decades of work and an important moment that's happening. So as much as possible, throughout this week, throughout the year, be intentional of bringing awareness to what these moments, even though not fun ones, are reflecting.